All right, we've got another question here. What kinds of patients make for the best patients, and what types of people make for your toughest patients? Really not too hard to answer there. I would say every single day, us dentists, we work really hard to make people happy. And what people and patients aren't connected to is the unpredictable nature of dentistry. It's not screw into the wall. It can be unpredictable and not as textbook as you think it could be. If you move during the procedure, we work in the world of millimeters. And so if you move your leg, if you shake your leg, it could cause us to move slightly and things don't happen the way we want to, or your tongue moves during the procedure. So I would say that the best patients are people that roll with the punches, that are grateful for the procedure regardless of the outcome. Now, of course, you hope you find a dentist that cares about people and wants to do good work. And most dentists are like that. We kind of go into this profession wanting to help people. So naturally, dentists are that type of person. So the best patient is a person that can be able to sit through a procedure well, a person that asks good questions, curious, cares about their teeth, a person that trusts us dentists. Now, we understand that you don't know what's happening inside your mouth, and so you're very curious. You got to make sure you protect yourself, ask the right questions, and there's no issues with that. But it's always easier when we see a problem. It looks like it's pretty textbook. This is the solution. We do the solution, and everyone's happy. We can move on and move forward pretty quickly. Now, the toughest patients are, I guess, maybe the opposite of that. People that have a tough time sitting in the chair, for example, or a person that has to go to the bathroom or needs to stop a lot. A lot of times, whenever we're doing things inside the mouth, there's a lot of water accumulation. So, individuals, believe it or not, there are some individuals that have a really tough time closing the back of their throat, and they panic whenever the water builds up inside their mouth. And if there are times where us dentists, if the procedure takes an hour and a half or 2 hours, in some of these patients, we have to stop every 5 minutes. And so you can imagine us dentists, we're really trying the best we can to do a good job. But if we have to stop every couple minutes for whatever reason, it can be frustrating because us dentists might not be super patient in that moment with so many interruptions. So that's a challenge. So I would say that the toughest patients are individuals that, for whatever reason, have a hard time sitting through the appointment. And then after that, blame us for how bad the experience may be because of the unpredictable nature of dentistry. Those patients are just tough on the soul a little bit. So.